weight loss drugs, anti-obesity medications, Ozempic. What exactly are we calling these medications? Well, turns out it's not that simple. Hey, I'm Steph Wagner. I am a dietitian specializing in obesity management, including patients who have had a bariatric surgery or utilizing an obesity management medication. So even what we call the drugs are kind of all over the place. A lot of the public might use terms like weight loss drugs, drug shots, injections, or just use the word Ozempic at kind of like Kleenex. They're all Ozempic. Well, it's actually a weird time that there's new medications, but we don't know exactly what we're calling them. You might see providers use the phrase anti-obesity medication or AOMs. I've seen that a lot. If I'm taking a webinar or a course, they might say AOMs. But even that has had a little bit of pushback that maybe we shouldn't be using the word anti-obesity medications. You know, we don't say anti-cholesterol or anti-blood pressure, right? So there's a little bit of a question there. Should they just be obesity medications or obesity management medications? Well, there's 6 FDA-approved medications for chronic weight management. So maybe that's what we call it. I don't know. I think it's an interesting topic that we don't quite know what we want to call these, and we hear them called different things. For me, I'll just be calling them obesity management medications because that just makes the most sense, I guess. So in this video, we're going to talk about what 6 medications have FDA approval for being safe and effective for obesity management. Now, I also want to talk about the best place to go get a prescription or where to get it filled. We're going to talk about supply, we're going to talk about cost, but this is going to be a lot of information in a short YouTube video. I'll have a lot more information on bariatricfoodcoach.com or on subsequent videos where I'll go through each of the medications. Well, first up, let's go in order of kind of oldest to newest of the 6 medications. The oldest medication that's FDA approved is Phentermine. And yeah, we still use it today because it is the most affordable. It's the cheapest medication there is, and for some it is still very effective. After that, we have drugs that came around 2012, Qysemia and Contrave. Those are drugs that contain 2 different ingredients, so I'll share more about those. There's also one called Xenical, which is more for fat malabsorption. So you might think about Orlistat, Olestra, Olean. We're going to talk about what all those words, but if you're thinking of those wow chips that had like the disclaimer on the bag, then your brain wouldn't be too far off the beaten path of what that medication does in terms of fat malabsorption. But then we move into the GLP-1 medications. Saxenda was the first one to kind of get the party started. And then the 2 newest FDA drugs that are getting all the attention are Wegovy, which is the same active drug ingredient as Ozempic, but Ozempic is a diabetes medication. Wegovy is FDA approved for obesity management. And then the newest FDA approved medication is Zepbound, which is a tirzepatide is the drug, and that is the same as Mounjaro for diabetes. So tirzepatide has shown to be the most effective for weight loss and for A1C lowering. But actually, there's more. There's more medications in FDA trials right now. There's 2 in stage 3 trials. Qysemia, which is a Novo Nordisk product, retatrutide, which is an Eli Lilly drug. Those are showing even more weight loss. And there's more medications that they are really hopeful will target more fat loss and preserve lean body mass, which would be amazing. So all of that to say, it's not slowing down anytime soon. There's a lot going on in the world of medical management of the disease of obesity, and these medications can absolutely be used after bariatric surgery as well. So let's talk about who can have these medications. They are indicated for those with a BMI of 30 and above, or a BMI of 27 and above with a weight-related comorbidity. Or it could be a bariatric surgery patient that has undergone a long plateau, they're more than a year out, or weight reoccurrence. So most of the time, medications won't be used within the first 12 months after surgery, but they might be used in conjunction with surgery down the road. Now, who should prescribe the medications? I I think this is an interesting area because I do get the question asked a lot. Can I go to somebody other than my doctor? Well, my first answer would be if you've had a bariatric surgery, I would start with your bariatric program. They may have medication right there. They might have a bariatrician or a PA or somebody that administers the medical management, even for post-op bariatric surgery patients. So I would start there because, they're your team. You're their patient, and they would have your weight history, and they would have a lot, of your journey right there in your medical chart. If that is not an option, I would go to obesitymedicine.org and search for a provider using your zip code. But that will help you find a doctor that is a board certified obesity medicine doctor. And I would say that obesity is a specialized field. And so working with a physician or physician's assistant that is specialized in obesity management is where you want to go. You want to go to the specialist. Not saying that you couldn't go to a primary care doctor, and sometimes that's who you have access to. But in general, I do think this is a situation where you want a doctor that knows these medications well. Sometimes they know how to layer the medications or when to change them or how to make them most cost effective. So I think that is a situation for trying to find the right place for where to go with medications. Now, these meds are FDA approved with healthy eating and physical fitness. So definitely working with a dietitian. I have tons of resources at Bariatric Food Coach. Again, whether bariatric surgery patient or medications, the medications really are providing a lot of similar things to surgery. There's some nuances there, but the resources on my website really would work for anyone with a medication as well, or both. Using resources like that to keep you on track. The whole point of the medicine or a surgery is a tool in the toolbox to keep you going down that path of eating well and changing your lifestyle so that you can have long-term management. It's not about losing weight really fast. It's about building habits so that you can lose fat, preserve muscle, and make your body metabolically active so that you can maintain your weight loss in the long run. You do want to discontinue medication for two reasons. Either one, if you're not tolerating it, if the nausea is not getting better. A lot of patients, especially with the GLP-1 injections, they may get nauseous right when they start the medicine or anytime they increase the dose, but it will get better. If it's not getting better, you want to talk to your doctor and you may need to discontinue it, maybe try a different medication. So definitely stop if the symptoms are not improving your quality of life. And the other reason why someone might need to stop it is if it's not effective. And that makes you wonder, well, how do you know if it's effective? Typically, we say if you're losing 3 to 5% at the 12-week mark, then keep going. But if you're not seeing that, your provider might revisit which medication might be a better fit for you. Now, you also want to know where you're getting the medication from. Because supply issues and insurance coverage, those have been their two biggest barriers. For one, can you afford it? And for two, can you get it filled? And because those two things came up, compounding pharmacies have emerged. And it's kind of maybe a few bad eggs makes compounding pharmacies a little tricky. So some of them may be just fine, but there have been compounding pharmacies that have been using salt forms of semaglutide, which is not FDA approved. FDA is putting out a lot of warnings about using compounding pharmacies. I was on a vacation and I saw a salon, massage, and semaglutide, compounding shop, like the old school sign. I was like, I don't think that's where I would want to go for my medication. So I think it does matter if you're not using a pharmacy and you're going to use a compounding pharmacy, what really is that medication that you're getting? So again, it may be fine, but I think it brings up a lot of bells and warning signs and whistles of is this really a safe medication for you to put into your body? That's also true with the direct-to-consumer pharmacies. A lot of them, if you go online, they might be using compounding pharmacies to fill those prescriptions. So just know what's going on because it may be okay, but it may be not the same thing as what you thought you were getting. The other benefit of working with a provider instead of doing a direct-to-consumer is if you have other medications or other existing conditions, sometimes the online situations, maybe they're fine, but maybe they don't know to look at the whole picture and if that medication is right for you. Whereas working with a a physician and going to an obesity medicine specialist, they will know if there's any things to consider with the bigger picture for your health. So there is a lot going on in the world of medications to manage the disease of obesity. I will be sharing more videos to go through each of these medications in more detail, but definitely check out my resources, whether you want to get back on track after bariatric surgery, whether you're starting a medication. Wherever you are, I think it's a great spot for you. And definitely join my email list. Every week I have a newsletter that has my menu for the week, recipes, eating tips, products, a weekly video, so much more. All those links will be below. Thanks for watching.